Everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform. I hope my voice is audible to everyone. And in this segment, we're going to talk a very important topic, and today's topic of choice is nothing but PDA. So, what is PDA? In this segment, we're going to talk about important topics and important points. Top 20 points on patent ductus arteriosus, which is a very important topic for basic, MBBS and as well as for the super specialty courses. Patent ductus arteriosus. For the newcomers, this is the Unacademy NEET PG platform. My name is Dr. Anand. I'm MD Pediatrics, and this is the Unacademy platform. And I first of all, I would like to congratulate, what you called to our amazing students who are working really hard. I mean, this is the FMG December 2021 batch who have worked really hard, and they deserve their faces to be seen and shown to all over the world because they have worked really hard, and now it's time for our other students to work really hard and to give their best shot in the this one what do you call it in the upcoming exams. And also at the same time, we have this free test fee. This is a free test calendar for all the new students, every Saturday, 7th, 8th, 9th, 11th, 22nd January, and then all the alternate Sundays, 9 a.m., 9 p.m. We have this amazing free sessions and free test, which I want every one of you to participate. It will be really nice. And also at the same time, we have something known as plus subscription in the Unacademy and something known as iconic subscription. In the plus subscription, you get to you get the access to all my live and recorded classes. You get to study from the best of the best educators all over the India, and also you get to participate in various tests and quizzes, and you can watch me on your Android, on your iOS devices. This is the plus subscription. As far as the iconic subscription is concerned, you get the Unacademy platform, and also at the same time you get the Prep Ladder subscription. All the clinical notes, video lectures, question bank, rapid revision, and dream notes. Everything you get on the iconic subscription. Okay, and hello Sayani, hello Osama, Mohammed Mazhar, Karan. Hello everyone, dear. And today is a very good topic, patent ductus arteriosus. We have some amazing questions coming up, and in the Unacademy app, we have a special class feature where basically we make a lot of MCQs poll. We can ask any doubt anytime. You never miss the classes because all the lectures are recorded in the YouTube channel as well as in our Unacademy app also. Okay, and most importantly, we have the best of the best, highly effective question bank, and also at the same time we have already made a focus FMG 2022 batch and a target NEET PG 2022's MCQ discussion batch. I hope you guys are a part of it because it is going mind blowing. And also at the same time, I told you plus subscription and the iconic subscription, and being an MBBS student, it's become difficult to buy a big pack. So if you use the small code, it will be little financially beneficial for you to buy a big pack. This is a small code, Dr. Anand, which you can use. So right now, within half an hour, 45 minutes, we have a test like of the pathology. If you're a newcomer, then you can study with me pathology test series we have of Dr. Priyanka Sachdev. She's a wonderful person and a wonderful faculty. Her live session is there, like the MCQs test is there at 9 p.m. today. If you're free, guys, you can watch it. And yes, so yes, where is Pancake? Pancake aa gayi? Yes. So yeah, what do you call Pancake? First of all, where were you? We missed you. Everyone missed you in the evening class. And today evening, Pancake 5:15, we had a class 5:15 to 6:15 on the YouTube channel. And today we covered ventricular septal defect (VSD), and also we covered very important syndromes, Dijot syndromes, Williams syndrome, and multiple other questions on the various syndromes in pediatric cardiology. So today's topic of choice is nothing but today's topic of choice is nothing but we have this PDA. So very good, Pancake. Yes, homework. You are the only student who is so enthusiastic about the homeworks, which I really love about you. This part and very nice. And we'll talk about it. Let's talk about this session today. Patent ductus arteriosus, right? PDA. Before starting any important session, we always have this motivating quote, and today's motivating quote is this meaningful picture. First of all, I would like to thank Dr. Savan, one of my junior who is right now online, and he only had sent me a picture. I mean, he is my messenger. He sends me very good pictures because I have searched the whole Google, and all my motivating quotes of the are already updated. So this is a very wonderful quote Dr. Savan had sent me. So this is life. This is life. सबको सक्सेस दिखता है, एवरीवन, एवरीवन, we say, this fellow has a Porsche, this fellow has a BMW, this fellow has a very big house. Oh my god, my friend is so rich, he has three cars, he has three cars. You don't know my friend, he has a lift also in his house. So what is all this? All this is success. We all say success, I want to be successful, I want to be rich. But behind this success, how much hard work, like behind this success, what all things are there? Of course, hard work is there. Then we have persistency. Consistency is the key, yes or no? Consistency is the key, of course. Yes, Pancake, you can definitely send me what you call quotes. I will be highly honored if you can send me some important and some meaningful quotes of life, which we can share to all rest of the world on this planet. It will be helpful. The only reason for my existence on this planet is to share knowledge and to share meaningful words to all of you. And third, to eat. I love eating. I love eating. Okay, so can we focus on this slide, dear? Yes, exactly. So, Hanji, क्या कहते हैं? This is nothing but success, right? Success सबको दिखता है. Everyone thinks, success is so amazing. But what is behind the success? Number one, there is lot of hard work. Number two, there is lot of persistence. I always like what's my personal favorite is consistency is the key. Consistency is the key. If you want to be on the top of your game, you have to be consistent. It is not just you made something and people are proud of you. No, you have to be consistent. That's it. If iPhone 7 is coming next year, iPhone 8 will come, iPhone 9 will come, and today iPhone 13 Pro has come. So like every year the iPhone people are working hard and they are updating themselves. But the most important is consistency is the key. Next, what all things have you you need to do for being success? Late nights, you have to work really hard, day night 24/7, this that, you have to work hard, you have to really work hard. Then of course rejections. Lot of people will humiliate you, lot of people will downgrade you, lot of people will make fun of you, lot of people will say you are not worth it, lot of people will say, oh my god, you're such a kid, why are you doing all this? Lot of people will say, you will clear exam, have you seen your face? My friend, she was a topper in her batch, she had to take two attempts to clear a batch. You will clear exam on one go? I don't think so. So people, if someone say you like that, and you should answer them back that I don't care what you think, but I definitely know that I will clear. You should think about yourself. So like that. So, and what all we have done, lot of sacrifices. Again, one of my personal favorite, discipline. Discipline is so important, bro. Discipline is so important. And once, consistency is the key. Like consistency and discipline are, can you understand, they work very parallel. People who are disciplined are only consistent. People who are not disciplined are not consistent. People who are disciplined means people who have a timetable, people who have a schedule, people who have a value of money, people who have a value of time. So people who have a value of time, people who have a schedule are persistent. If you don't have a schedule, if you don't have a value for time, you are not consistent, you are just one in a crowd. भीड़ में भीड़ का हिस्सा हो तुम, और बस यही प्रॉब्लम है. Then what sacrifices you have to get? Criticism, doubts, failures, risk. So these all things you have to overcome, and the end story is you will get success. And remember, at the same time, success is not life, it is a part of life. I'm telling you a very 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 practical aspect of life. Success is not life, it is a part of life. And failure also is not life, it is a part of life. So once you are a successful, doesn't mean you will always stay rank 1. You will dip down someday and again you will get up. And once you are in failure, doesn't mean you will always be in failure, you will become up. Someday you'll become down, someday you'll become up, someday you'll become down. So why I'm saying all that? Because most importantly, don't keep ego with you. Don't be arrogant, don't be so proudy, or don't have ego, that I have done so much, so let me be, kind of egoistic person. No, be humble, be nice, be kind. कहते हैं ना, हर किसी का दिन आता है. आज तुम्हारा दिन आया है, कल किसी और का आएगा. So it's better to be calm and composed, than to have a ego. ठीक है? Am I right or wrong? उदित, पैनकेक और सावा, ठीक बता रहा हूँ मैं, गलत तो नहीं बता रहा कुछ? So today's topic of choice is patent ductus arteriosus. Patent ductus arteriosus, it's a very good topic. I want you guys to participate as much as possible, because patent ductus arteriosus has a lot of MCQs. It's a very smart and very easy, very fast topic, but it carries a lot of questions, so I want you guys to be with me. Hmm. Okay, so patent ductus arteriosus, point number one. PG entrance question number one, patent ductus arteriosus. This one, patent ductus arteriosus is between what and what? Pancake. What do you think? Patent ductus arteriosus is between what and what? So yes, patent ductus arteriosus, point number one, it is between the pulmonary artery and anyone? Yes, pulmonary artery and descending aorta. Yeah, am I right or wrong? So patent ductus arteriosus is between the pulmonary artery and descending aorta. That is the first PG entrance question. It is not between the pulmonary artery and ascending aorta or arch of aorta. It is between the pulmonary artery and descending aorta. That is the first PG entrance, very important question number one. Okay, so again, can we appreciate this picture? Can we spend 5 seconds for this picture? What is this? This is the, like, kind of a ascending aorta. This is the arch of aorta, and this is the descending aorta. Yes or no? So, and this is the pulmonary artery. So between the pulmonary artery and descending aorta, this is our patent ductus arteriosus. Patent ductus arteriosus, and we all know that then that in fetal circulation, in the fetal circulation, ductus arteriosus is normally open. It is good for us to keep the ductus arteriosus open in the fetal circulation. Once the baby is out, once the placenta is cut, so the ductus arteriosus slowly starts getting to close. Are you understanding? Yes or no? Once the baby is out, the ductus once the baby starts breathing, placenta is cut. Placenta was secreting placenta. Are you understanding? Yes or no? Just remember right now one thing: placenta gets cut. So what happened? Ductus arteriosus slowly start getting to close. Okay, and that's how it happens. Okay. Now, very importantly, remember that ductus arteriosus is just distal to the left subclavian artery. So this one is our left subclavian artery. So ductus arteriosus is just distal to the left subclavian artery. Ductus arteriosus is just distal to the left subclavian artery. Okay, number one. And ductus enters the pulmonary artery. This ductus enters the pulmonary artery at its bifurcation. Can we see this pulmonary artery getting bifurcated? This is the pulmonary artery which is getting bifurcated. Yes or no? One path is going here and one path is going here. So at the bifurcation of the pulmonary artery, ductus is present. Yes or no? Do you agree with me, guys? Yes or no? Yes? Very good. So number one, ductus arteriosus is just distal to what? It is distal to left subclavian artery. That is the first PG entrance question. Second PG entrance question, true or false? That ductus enters the pulmonary artery at its bifurcation. So yes, at this bifurcation, this ductus is entering. Done. Again, three PG entrance questions we have covered. Next point. What happens in ductus arteriosus? If this is the ductus arteriosus, which we all know that it is a left to right shunt. The blood will go from the, this is the ductus arteriosus, and the blood is, it is a left to right shunt, right? So if the blood is, if this is congenital heart is a left to right shunt, what happens to M1? What is M1? Mitral wall. We all know that we have S1 and S2. S1 is the first heart sound, which is because of the closure of tricuspid wall and mitral wall, whereas S2 is the second heart sound, which is because of the closure of the pulmonary wall and the aortic wall. So my question is, what happens to the M1 here? This M1, will it be loud or will it be soft? Who will tell me? Karan, Rashi, Osama? Yes, very good. When more and more blood will, and see, normally also blood will enter from the superior vena cava to right atrium to right ventricle to the pulmonary artery, and pulmonary artery and to the lungs. This is normal. Again, in left to right shunt, Can we understand that more and more blood is entering from the left side of the heart to the right side of the heart? Yes or no? So yes, more and more, more blood entering into the pulmonary artery, in the pulmonary artery. Yes, more and more blood will enter into the pulmonary artery means more and more blood will enter into the lungs. Yes or no? When more and more blood enters into the lungs, and lungs are connected to what? Lungs are connected to the left atrium with the help of pulmonary veins. So more and more blood will enter the pulmonary veins, and more it will touch the mitral valve. So that's why in a case of patent ductus arteriosus, you will get a loud M1. You will get a loud M1 because more and more left to right shunt is there. More and more blood is going towards the lungs. More and more blood is coming in the left side of the lung. And here we have the mitral wall or the bicuspid wall. So you'll get a loud M1. You'll get a loud M1. Done. Has everyone understood this much, that more and more blood, once it enters to one cavity, the sound becomes loud, not soft, it becomes loud. ठीक है, डन? हामिद समझ में आ गया डियर, है ना? ओके ब्रो। नो बट इट विल बी लाउड नो डियर, बिकॉज देखो ना, नेचुरल सी बात है, ब्लड अब सारा का सारा प्रेशर कहाँ पे आ रहा है? नॉर्मली फ्रॉम सुपीरियर वेना केवा टू राइट एट्रियम एंड देन टू राइट वेंट्रिकल एंड देन टू pulmonary artery and then to the what you call lungs. This is one pathway. And now from the left side again to the right side, right? So more and more pressure on the pulmonary artery, more and more pressure on the lungs, more and more pressure on the pulmonary veins, and more pressure on the left atrium, and more pressure on the left ventricle. That is why bichara mitral wall becomes very loud, and that is why when there is more and more pressure on the left side, left atrium and left ventricle, you will see left atrial hypertrophy, you will see left ventricle hypertrophy also in a case of patent ductus arteriosus. That's how it is, Pancake. Okay, that's how it is, dear. That's how you have to hypothetically imagine in your mind that more and more pressure on the lungs, more and more pressure on the left side of the heart, and mitral wall will be affected, which will be very loud. Okay, that's you should know. Okay, one video on the heart sounds. Hanji, that's true. I'll make it, dear. मैं बनाऊंगा एक video. So we'll get a left atrial hypertrophy, we'll get a left ventricle hypertrophy in a case of PDA, and of course we'll get a loud M1. ठीक है, आगे बढ़ते हैं. Very good. That's what, देखो, more and more blood entering the left atrium. When more and more blood entering the left atrium, the M1 will be loud. It will be loud. Okay, that is the first point. Second point, very important, shunt murmur. So remember shunt murmur. See, there is something known as flow murmur and there is something known as shunt murmur. Okay, so it's a very beautiful picture of PDA. Yes or no? This is the very nice picture of PDA which is showing a left to right shunt, है ना? So yes. So shunt murmur. What is shunt murmur? Shunt murmur is due to abnormal communication between two chambers or vessels. Shunt murmur is due to abnormal communication. In the patent ductus arteriosus, there is an abnormal communication between the pulmonary artery and aorta. So shunt murmur is due to abnormal communication between two chambers or vessels. So in this case, the shunt murmur in a patent ductus arteriosus will be continuous machinery murmur. Please remember, continuous machinery murmur. Continuous machinery murmur is the shunt murmur which we will see in a case of patent ductus arteriosus. So what all points have we covered just now? Number one, the shunt murmur in patent ductus arteriosus will be continuous machinery. The M1 will be very loud. At the same time, will be understood that patent ductus arteriosus, it is a left to right shunt. It is a asynotic congenital heart, and it is between pulmonary artery and descending aorta. And also we understood that ductus arteriosus, it is distal to what? It is distal to left subclavian artery, and it enters where? It enters the pulmonary artery at its bifurcation. Bifurcation. Yes, exactly. Shubhangi Kaushik is very right. Generated by a continuous blood flow. That's why it's known as continuous machinery murmur. That is the first point. Okay, what will happen to in a case of large PDA? Now, this is a again understanding wala question. Not just a small PDA. I'm talking about a large PDA. What will happen to S2 in a case of large PDA? You know that we have something known as S1, we have something known as S2. S1 is the first heart sound because of the closure of the tricuspid wall and the mitral wall, whereas S2 is the second heart sound because of the closure of the pulmonary wall and the aortic wall. And we all know that Like first heart sound divided into T1 and M1, like the tricuspid and mitral closure together. And second heart sound is divided into P2 and A2. P2 being the pulmonary component and A2 being the aortic component. So in general, we all know that, that A2 closes early than P2. Second heart sound, which is produced by the closure of the semilunar valves or aortic or pulmonary valves, normally what happens, normally lot of blood has to come from the superior vena cava and inferior vena cava to the right atrium, and then to the right ventricle, and then to the pulmonary artery. So pulmonary artery closes little late. Normally pulmonary artery closes little late. That in general we should know that A2 closes early than P2. A2 closes early than P2. This is the normal thing, happens in any case. Okay. Now my question is, what will happen to a S2 heart sound in a large PDA? Not just a PDA, large PDA. Something else happens in large PDA. That's why I'm emphasizing large PDA. So now what happens in a case of S2 sound, in a case of large PDA, will be paradoxical splitting. Now please, number one, first write that it's paradoxical splitting, and I'll explain you now what is paradoxical splitting. In large PDA at S2, you will see paradoxical split. Paradoxical matlab ulta. Paradoxical split. What is this paradoxical split? Number one, Hanji Pancake, I'll tell you, dear. Number one, now listen very carefully. It's like very easy. Just listen and listen to the text which I'm writing, which I have written, and listen to me. There will be paradoxical splitting of S2 in a case of large PDA. This is an exam question. Why there is a paradoxical split? उल्टा कैसे split हो जाता है? क्या है ये? Number one, as we all know that PGA is a left to right shunt. The blood is flowing from the left to the right because of the higher pressure and higher musculature at the left side of the heart. Normally, if I open a PDA, it's a left to right shunt. Then what happens? In large PDA, there will be left to right shunt followed by pulmonary vascular obstruction. This is written pulmonary vascular obstruction. Okay, pulmonary vascular obstruction. Do you remember I told you like a reversal of shunt kind of a thing? A shunt which will be left to right, then more and more blood will go to the pulmonary artery, yes or no? Slowly, what happens? I told you yesterday, the pulmonary artery starts to get close, or you can say pulmonary atresia starts to happen. That's what the book is saying, that it will lead to pulmonary vascular obstruction. Okay, so because of pulmonary vascular obstruction, or you can say pulmonary stenosis, or you can say pulmonary artery hypertension, what will happen? The shunt which was left to right becomes right to left. Yes or no? Eisenfingerization. Yes, very true. So again, my question is, why there is a paradoxical split of S2 in a case of large PDA? In a large PDA, number one, there will be left to right shunt followed by pulmonary vascular obstruction, later having pulmonary stenosis or pulmonary artery hypertension. The shunt which was left to right becomes right to left. Okay, this much hypothetically you have to imagine in your mind. Then what happens? So now the shunt which is right to left, what will happen? The more blood, now the more blood is in the right side. Yes or no? Like what happened? See this carefully. So now what will happen? So A2 now will close late than the P2. Yes or no? True or false? I am saying now shunt which is now become ulta. So now will the A2 close early or will the A2 close late? Now the A2 will close late than the P2, because normally A2 closes first, but in large PDA, P2 closes first than the A2. Now this is known as paradoxical split in a case of large PDA. Now this is known as paradoxical split in a case of large PDA, because in a case of large PDA, a shunt which was left to right becomes right to left, number one, as now it is become right to left. So normally A2 closes early than P2. So now A2 now will close late than the P2. So that's what, this is a paradoxical split. Ulta ho gaya. So that's what in a case of hello, okay, good evening everyone. So yeah, that's what. So in a case of large PDA, you see paradoxical split. Done. I'll repeat again. What did we study? Number one, at S2 में क्या होगा? Paradoxical splitting होगा. S1 में क्या होगा? जो है हमारा ये tricuspid wall है, it will be a loud T1. What kind of murmur will you see? You will see a very importantly continuous machinery murmur. Continuous machinery murmur. And PDA, it is a left to right shunt, and it is a acyanotic congenital heart disease. Okay. Okay, and that's it. And now this was shunt. One is shunt murmur, one is flow murmur. What is flow murmur? Flow murmur is due to turbulence of blood flow when blood is flowing through a narrow valve or excess blood is flowing through a normal valve. Please remember there is something known as shunt murmur. There's something known as shunt murmur, and there's something known as flow murmur. Hello, good evening everyone. Okay, doctor, because you can say that more blood goes into the left ventricle, so aortic valve closes late. No, dear, you can't say that. Doctor and caffeine, you can't say that more blood going into the left ventricle, so aortic valve closes late. No, just imagine whatever I have told you. Imagine that way only. A shunt which was left to right becomes right to left, and then the A2 closes late, then P2. This is paradoxical splitting, and that's it. That's how the Nelson have told that in a case of large what you call PDA, you will see paradoxical splitting. These words are very very important, because remember these lines are very very important. Okay, these are like three important PG entrance question. In a case of atrial septal defect, our first class was on atrial septal defect, and then I told you there is a wide fixed split of S2 in ASD. Why it is there? Again, if you're a newcomer, please go to the channel of the atrial septal defect. It's the previous videos we have covered of cardiology. There I have told you atrial septal defect. What happens in S2 in atrial septal defect? There is a wide fixed split. And today in VSD class, I told you in the evening, there is a wide variable split of S2. And now in a case of PDA in S2, there is a paradoxical split in large PDA. So that's what wide fixed split, wide variable split, and paradoxical split. ASD, VSD, and PDA. That's how we have to remember. That's how it comes in exam, and that's how it is given in Nelson, and that's how we should channelize our mind to remember it. Okay, wide fixed split, wide variable split, and paradoxical split. Okay, so now coming back to our shunt murmur. What is shunt murmur? One is shunt murmur, one is flow murmur. What is shunt murmur? You remember shunt murmur, nothing but abnormal communication between the chambers or vessels. That is shunt murmur. And you see a continuous machinery murmur, shunt murmur in PDA. What is flow murmur? Flow murmur is due to the turbulence. It is due to the turbulence of the blood flow when the blood is flowing through a narrow valve or excess blood is flowing through a normal valve. So remember the flow murmur in a case of PDA will be at the mitral area, and it will be a delayed diastolic murmur. It will be like a delayed diastolic murmur. Delayed, but that same reason only which we were checking in VSD also. In VSD also there is a delayed diastolic murmur at the mitral area. So this is our mitral area. This is the bicuspid valve, and delayed diastolic. When more and more blood enter the left to right, more and more blood enter the pulmonary artery, more and more blood enter the lungs, and more blood enters the pulmonary vein, and more blood coming into the left atrium, and then more blood going into the left ventricle. So that's why when there is more and more blood into the left atrium, there is a delayed diastole. One is systole, contraction of the heart, and one is diastole. So diastole is delayed because so much of blood is coming from above and going down. So you'll get a delayed diastolic murmur. Yes, exactly, Pancake. So delayed diastolic murmur as a flow murmur in the mitral area, and the shunt murmur will be a continuous machinery murmur. Okay, that you should know. Okay, yes, and now again a very wonderful quote. Again, ये सावन ने मेरे को send किया था. You cannot suffer the past. You cannot suffer the past or the future. To be frank, you cannot suffer the past or the future because they do not exist. Does your past exist right now? No, right? Past is past. Is your future existing right now? No, future is future, past is past. What is present today? Today is today, right? You cannot suffer the past or the future because they do not exist. What you are suffering is your memory and your imagination. It's again a very nice quote. Sawan had sent me. मुझे तो बड़ा पसंद आया ये. You cannot suffer the past or the future because they do not exist. What you are suffering right now is your memory, is the memory and imagination of your past or of your future. So, what is the moral of the story? Moral of the story is control your mind. Control your mind. Don't let your mind control you. You control your thoughts. You control your mind. You control your heart rate and you control your life. Okay. So that's very important. Next, what are the complications of a large PDA can lead to? Anyone? What are the complications of large PDA? So same thing only everyone knows about it. The complication of a large PDA will be the this is the very now we are entering a new pattern. Now we are entering a new important pointers. Like till now everyone was knowing that a complication of large PDA will be a Eisenmingerization, yes or no? Will be a reversal of shunt, yes or no? This much we know, right? That a reversal of shunt can happen as a complication. Even infective endocarditis can happen as a complication of large PDA, right? This much we know from the previous classes. But now, very importantly, we need to understand that a large PDA can lead to number one, renal insufficiency. Number two, necrotizing enterocolitis. What is NEC? Necrotizing enterocolitis. Okay, I will not go into detail of NEC that we have done in previous classes. If you're a newcomer, please watch the previous videos on the Unacademy app and also on the YouTube channel. Every single video is free. Watch it before it goes to private or before it gets locked. So yeah. Now listen very carefully. I'm saying a large PDA. A large PDA can lead to renal insufficiency. In simple word, nothing but acute kidney injury. Renal insufficiency, nothing but injury, kidney injury, right? Number two, it can lead to stomach issues, necrotizing enterocolitis. It can also lead to brain hemorrhage, intraventricular hemorrhage. It can also affect my lungs, a case of bronchopulmonary dysplasia, and also it can affect my heart. Now listen, now tell me, now this is the thought process. Large PDA. I'm saying large PDA is affecting my kidneys, is affecting my, GIT, is affecting my brain, is affecting my lungs, and is affecting my heart. Yes or no? Can we say like that? Can we appreciate this line? Yes or no? Please put a like button if you're able to understand. Yeah. Okay, Deepak is saying something. Exam future में है, but suffering and sacrifice तो अभी कर रहे हैं. Yeah, bro, that's true. That's very true. लेकिन that's what ये चीज़ें काम आएंगी ना. ये सब काम आएगा. ये सब मेहनत काम आएगा. अब मैं भी तो इतनी मेहनत कर रहा हूँ. देखो, मैंने एमबीबीएस कर लिया, मैंने एमडी कर लिया, मेरी एक परमानेंट जॉब है, लेकिन मैं अनअकैडमी में हूँ, मैं यहाँ पढ़ा रहा हूँ, वहाँ पढ़ा रहा हूँ, ये कर रहा हूँ, वो कर रहा हूँ. तो ये सब भी तो मेहनत ही है एक तरह से. ज़िंदगी में फ्री में कुछ नहीं मिलता. I was reading one very beautiful one story. Like, what is tough? What is tough? What is tough? A woman will say being a housewife is very tough. A clinic में a compounder will say being a compounder is very tough. Going to a retail shop, किराने की दुकान, तो जनरल स्टोर हम जाते हैं. The general store fellow wala, if you ask him, he'll say being a general store, like a person, सब कुछ देना जो किराने की दुकान में होता है, it is very tough. If you go to a grocery store, then that person will say my job is very tough. So everything is tough. And being a doctor, oh my god, that's another level only. Being a nurse has to do so much. You have any idea? Being a doctor, I mean, being a doctor, so it's मुझसे पूछो, being a doctor is very tough. अगर कोई मुझसे पूछे तो मतलब in my COVID duties कितनी मेहनत करी है हमने. मतलब you can't even go to washroom also once you have put a PPE. What is PPE? Positive, that this protective equipment which we have, personal protective equipment which we wear it before touching a COVID newborn. So it's very tough. So everything is tough. Everything is tough. You can't say कि only being a doctor is tough. So what is the moral of story? Being a housewife is very tough. Our mom, I think, I hats off to our mothers. They're always on their toes. They're always, my dad will come, my mom will cook food for her. Then I will come. Then my elder brother will come. Then my wife will come. Everyone will come. She'll keep on cooking food from morning to evening. And we're like, and we always say, being a housewife is so easy. I am a doctor. I'm working so hard. So moral of the story is being a housewife is tough. Being a compounder is tough. Being a general store manager is tough. Being a doctor is tough. Being a nurse is tough. Being a grocery store is tough. But the moral of the story is which tough, which tough you want to adopt, which tough you want to do, which tough thing you want to do. That is the moral of the story. Because what is your passion? What is your passion? If you follow your passion, if you follow your passion, so that tough thing becomes very easy, becomes very easy. Are you understanding, everyone? That's why people ask me, should I take diploma in childhood, should I take MD pediatrics, should I take MD medicine, should I change my branch, and this and that. I always say one thing, like follow your passion, follow your passion, follow your passion, right? Yes or no? So everything is tough. Being a housewife is tough, being a compounder is tough. Are you understanding, everyone? I'm telling something which is really like a life quote. So being moral of the story is, being everything is tough, but which stuff you want to do, which stuff you want to adopt, you want to accept, and you want to continue. For example, teaching is very tough. I am having throat pain from last 1 week. I'm teaching 8 hours, 12 hours. We have this huge lectures on big auditoriums and all. Being teaching is so tough, and you can't say it's very easy. But I love teaching. I like teaching. I love sharing my knowledge. I think I have enormous amount of knowledge which needs to be shared before I die. So I love sharing knowledge. So it's very tough. Teaching is very tough, but this is my passion. So I'm doing it. So now it's not tough to me. Midnight, 2 o'clock also, I can put an unacademy class and I can teach you for 4 hours because I like teaching and I'm doing what I like. So that's what you should do. Whatever you like, you should do. If you want to be a singer, be a singer. Don't be a doctor. If you want to be a guitarist, be a guitarist. Don't be a doctor. Shreya Ghoshal, who is a beautiful singer, uh, she wanted to sing from the childhood. That's why she's following her dream, and now she's a wonderful singer. So she was doing something which she liked. Are you understanding? And that's what you should. Okay. So coming to this one, yes. Okay. Hanji, very good. Yes. चलो ठीक है, आगे बढ़ते हैं. हाँ जी. So it's a very easy, very thoughtful question. I am saying that a large PDA will, if a baby is having large PDA, he will have kidney injury, he will have stomach issues, nothing but GI issues, gastro necrotizing enterocolitis. He will have issue in the brain. He can have intraventricular hemorrhage. He can have issue with the lungs, nothing but bronchopulmonary dysplasia, and he can have myocardial ischemia also, nothing but heart issue. Why एक PDA होने से इतनी सारी प्रॉब्लम क्यों हो सकती है? Why being a large PDA, so many problem baby can have because of the very important exam answer, ductal steel phenomenon. Ductal steel phenomenon. All the blood, my dear, all the blood which is coming from the to the like from the lungs, which is coming to the left atrium and then coming to the left ventricle and then coming to the aorta, all the blood is going again back to the is going to the right side of the heart. Yes or no? So this is known as the duct, this is known as ductal steal phenomenon. The ductus is stealing the blood, the ductus is stealing the blood, and it is not allowing the blood to go to the whole aorta and then to the body. Are you understanding? This the ductus is stealing the blood, and this oxygenated blood is not able to go from the aorta to my heart, leading to myocardial ischemia, to my what you called lungs, leading to bronchopulmonary dysplasia, leading to IVH in my brains, leading to necrotizing enterocolitis in my GIT, and leading to renal insufficiency in my kidneys. Are you understanding? Yes or no? Yes. So this is known as ductal steal phenomenon, that all the blood has been stolen by the ductus arteriosus, all the oxygenated blood. So now aorta doesn't have much oxygenated blood, leading to the blood flow to all the vital organs and leading to a compromised blood flow, leading to something known as insult, and that is due to ductal steal phenomenon. Has everyone understood this much? Yes or no? You can put a golden heart or a cute emoji like pancake or something nice and sweet. Okay. ओके ठीक है. अच्छा हाँ, मैं पहले कमेंट्स पढ़ लूँ सारे. ओके, पैनकेक सेज बट योर मॉम इज अ डॉक्टर. येस डियर, माय मॉम इज आल्सो pediatrician, but now she has taken a pre-retirement. She had got a small ankle fracture, so now she's much better, and then she has crossed 60, 65 now she is. So and we all are earning in our family, so that's why she's not working anymore and she's taking care of the house. Okay. Okay. Okay, Saini, Rashi, thank you for teaching us. Yes dear. एग्जैक्टली ठीक है, डन डन। समझ में आ गया, स्टेफिलोकोकस राशि एवरीवन। मैं बस पानी पी लूँ एक। ठीक है, कोरोनरी स्टील फिनोमिनन, ठीक है, उस बारे में भी पढ़ेंगे बाद में, पर अच्छा आपने याद दिला दिया। आई गो थ्रू इट वंस। एंड my dad is a lawyer. My dad is a lawyer in Supreme Court. My brother, elder brother I have, he's also a lawyer in Supreme Court. I have elder sister, she's a, and my mom, she's a doctor, and I. Hmm. Okay. Now, please let's pay attention and let's finish this beautiful topic. Anji, so what do you call it? Yeah. So, number one, we understood that if there is a large PDA, then due to ductal steel phenomenon, all my organs will be compromised. Please read this line with me. Ductal steel phenomenon, it is a phenomenon where a left to right shunt causes significant retrograde flow of blood from the thorax and abdominal aorta to the pulmonary circulation. Means the blood which was going should go to my, kind of abdominal aorta and thorax and everywhere. There's a retrograde. There is a backflow. There is a retrograde blood flow of the blood. So this is known as ductal steel phenomenon. Half of the and retrograde blood flow to where? To the ductus arteriosus. Ductus arteriosus is like a magnet. Whatever that blood from aorta is going down, it is teaching the blood. It is like pulling the blood back to the ductus aorta. That is a ductal steel. Ductal is stealing the blood from the, like, it is the blood which is from the aorta going to thorax, going to the abdominal aorta. Full, it is snatching it back. That is ductal steel phenomenon, right? Next important, and this ductal steel phenomenon leads to systemic hypoperfusion. Yes or no? Can we agree this line with this line? Yes or no? That ductal steel phenomenon will have systemic hypoperfusion, and then means renal hypoperfusion, mesenteric hypoperfusion, coronary hypoperfusion, myocardial hypoperfusion, and all the hypoperfusion. And done. Okay, huh? Okay, that's good. I'll tell you, Pancake. I'll give you my Janam Patri only. Don't worry. I'll give you my time of birth, date of birth, my place of staying, and my full name and my time of birth. Okay. So, okay, next question. Due to this ductal steel phenomenon, Pancake, can you tell me? So, can they compensate by increasing the stroke volume? Now, this is the good question. Can anyone put some use some brains here? You Number one, there is a ductal steel phenomenon. Number two, all the blood from the abdominal aorta, thoracic aorta, it's coming back. The ductus arteriosus is pulling back, but some compensatory mechanism has to be there, right? Some compensatory mechanism has to be there. So my first question, number one, is that, so can they compensate by increasing my stroke volume? Yes or no? Okay, dear, बताओ। हाँ जी Osama, dear, बताओ। Can they compensate? Can my body compensate by increasing the stroke volume? What is stroke volume? Stroke volume is the volume of the blood pumped out of the ventricle of the heart during each systolic contraction. This is the contraction. So, what is stroke volume? During each systolic contraction, how much volume of blood is pumped out from my left ventricle? From my left ventricle, yes or no? हाँ जी, हाँ जी, ठीक है। ये तो होगी स्ट्रोक वॉल्यूम की डेफिनेशन। वॉल्यूम ऑफ ब्लड पम्प्ड आउट ऑफ द फ्रॉम द लेफ्ट वेंट्रिकल ड्यूरिंग ईच कॉन्ट्रैक्शन, राइट? So now the question is, can my body compensate by increasing the stroke volume? The answer is no. In the ductal still phenomenon, there is no increase in stroke volume. Why? Because the increased left ventricular volume load is poorly tolerated, as a preterm has a poorly compliant left ventricle. ओके, रिमेंबर दैट। मैसेज डिलीट करने की जरूरत नहीं है, कोई बात नहीं, गलत आंसर दे दिए चलेगा, उसमें कोई बेइज्जती नहीं हो रही, कोई प्रॉब्लम नहीं है। हाँ जी, ठीक है। सो आई रिपीट अगेन, नंबर वन, देयर इज अ डक्टल स्टील फिनोमिनन। नंबर टू, द ऑल द thoracic aorta blood, abdominal aorta blood has been stolen by the ductus arteriosus. So but body has to compensate, right? So will the body increase the stroke volume? Will the body increase the pump of the left ventricle? No. Why? Because again, in a preterm baby, left ventricle is very fragile. The increased left ventricle volume load is poorly tolerated, as the preterm has a poorly compliant left ventricle. A preterm has a poorly compliant left ventricle. तो क्या होगा? हाँ जी, सुरेश नायक क्यों डिलीट कर रहा है? कोई प्रॉब्लम नहीं है, चलेगा। मिस्टेक्स आर अलाउड डियर, मिस्टेक्स आर अ प्रूफ दैट यू आर ट्राइंग, मिस्टेक्स आर अ प्रूफ दैट यू आर ट्राइंग। मैं हमेशा कहता हूँ, एक गलती नहीं, हजार गलतियां करो। नो, नॉट वन मिस्टेक, डू थाउजेंड मिस्टेक्स। बिकॉज टुडे टुमारो यस्टरडे डूइंग सो मेनी मिस्टेक्स चलेगा, बट डूइंग मिस्टेक्स इन द एग्जाम इज नॉट अलाउड। सो राइट नाउ चलेगा, खूब बेइज्जती कराओ अपनी, है ना? गलती है तो क्या हो गया? याद तो रहेगा कि मैंने गलती करी थी और आनंद सर ने बताया था कि नहीं नहीं, स्ट्रोक वॉल्यूम नहीं बढ़ता। तो बढ़ता क्या है फिर? So hence they have a limited capacity to increase the stroke volume. So number one, stroke volume तो भाई नहीं बढ़ सकता, because preterm body is very fragile and ventricle doesn't have, a good capacity to increase the stroke volume. So double star mark needs super speciality question, but they can compensate by increasing the heart rate. So somewhere I have to supply the blood to the body, right? Somewhere my aorta has to go to kidney, has to go to GIT and everywhere. So what happens? Does the stroke volume increases? No. The heart rate increases. The heart rate increases in a case of patent ductus arteriosus. So tachycardia is one of the very important feature. If a preterm is having, it has admitted with to you with a case of tachycardia, then please patent ductus arteriosus should be ruled out, because patent ductus arteriosus, there is a ductal steal phenomenon. All the ductus has stolen all the blood from which is going from the aorta. But to compensate that, my heart rate will start increasing, my heart rate will start increasing. Okay. Yes, yes, that's right. Okay, ductal steal phenomenon. Karan, I'll repeat again, dear, no problem. See, dear, there's something known as ductal steal phenomenon, brother. um what is this ductal steal phenomenon, Karan? Ductal steal phenomenon. Normally, what happens, Karan, that the blood from our lungs, the oxygenated blood from our lungs enters the left atrium, then it enters the left ventricle, then it enters the aorta, and normally it should supply my whole body. But in a case of ductus arteriosus, Karan, ductus arteriosus is stealing the blood. Ductus arteriosus is a left to right shunt. Whatever blood from the aorta should go out to my whole body and supply to my whole body, that oxygenated blood has been stolen. By whom? By the ductus. And this is known as ductal steal phenomenon, right? This is known as ductal steal phenomenon. The ductus is stealing, or like a magnet, it is attracting all the blood towards, its pipe, and the blood coming from the aorta, and from the aorta, whatever blood has normally go to thoracic aorta and abdominal aorta, no, this whole thing. So ductus is attracting the blood or stealing the blood from that one also, from the thoracic aorta also, from the abdominal aorta also, and from this aorta also. So this is known as ductal steal phenomenon. But a body has to compensate, Karan. My body has to live, right? My body has to have a compensatory mechanism. The compensatory mechanism where the oxygenated blood should be supplied to the whole body. The compensatory mechanism will be that heart rate will increase. And preterms baby, heart rate will increase, and that will cause more and more blood to go to the whole body, and that's it. Done? Understood? So that's what. So when the heart rate increases, and that is known as hyperdynamic circulation. That is known as hyperdynamic circulation. So what are the clinical features? What are the features of a PDA? Number one, tachycardia is a very important feature of PDA, and because of tachycardia, there is a hyperdynamic circulation. Number two, number three, bounding pulses. Very, very, very important clinical question. Savan, are you there, brother? Savan, you're there. So Savan, I remember, if you have admitted a case of PDA, if you have admitted a preterm child, if you have admitted a preterm child who is a case of PDA, so what are the clinical features you will assess, kind of see? Number one, you will auscultate like the child, and you see whether it is a continuous machinery murmur and this and that, right? But at the same time, you will check the pulses because of tachycardia. Yes, exactly. Hmm. Right. So tachycard number one, because of the tachycardia, there'll be bounding pulses. And very, very important PG entrance question. Easily palpable dorsalis pedis artery. Because of tachycardia, there are bounding pulses. Bounding, इतनी bounding कि बिल्कुल पैर के आखिरी वाली. Because it is so much bounding that the last artery of the foot, that also becomes very bounding. So very, very important PG entrance question. A preterm child admitted with distress. That preterm child was having tachycardia. On examination, that child had a easily palpable dorsalis pedis artery. So what is your diagnosis? The diagnosis is patent ductus arteriosus, PDA. And dorsalis pedis artery is a continuation of which artery? Staphylococcus, Pancake, Rashi, Doctor. Dorsalis pedis artery is a continuation of which artery? It is a continuation of anterior tibial artery. It is a continuation of anterior tibial artery. Is the continuation of anterior tibial artery. ठीक है? अच्छा, Deepak is asking something, tachycardia for pediatric age and appreciating murmurs. How easy is this in the OPD, sir? It is not so easy to appreciate murmurs in the OPD basis, our Deepak, and but like appreciating murmur is fine, Deepak. We can appreciate murmurs. You can auscultate and appreciate murmurs. The mother will tell you some complaint. Either the mother will tell you that मेरे बच्चे को बहुत खांसी जुकाम बार बार. You need to ask. See, being a doctor, you need to rule out something. क्या आपके बच्चे को बार बार खांसी जुकाम होता है? Is your child having repeated upper respiratory lower respiratory tract infection? Number one. If it is having, then you will think of plethoric lung fields. Plethoric lung fields. Is your baby get sinus very fast? क्या आपके बच्चे के होंठ नीले होते हैं? क्या आपके बच्चे का होंठ या आपके बच्चे के पाम्स नेल्स नीले होते हैं बचपन से? हाँ जी डॉक्टर साहब, द माई बेबी गेट्स लॉट ऑफ साइनोसिस फ्रॉम चाइल्डहुड, सो यूल थिंक ऑफ साइनोटिक कंजेनिटल हार्ट डिजीज एंड देन यू विल ऑस्कल्टेट, राइट? And you'll get a murmur, just a murmur. Like I can't, I'll not say you'll get a delayed diastolic murmur or this murmur. Just remember, whenever you auscultate a murmur, no, I'll tell you a small trick. Whenever you auscultate and you see a murmur, right? And at the same time, one step you keep on the heart, and one your finger should be there on the pulse. One finger you put on the patient's pulse, and one stretch you put on the heart. If the pulse is coinciding with the murmur, like if the murmur is like shh 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 shh, what if the murmur is like this, and that shh 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 thing is coinciding with the pulse? Pulse be like dhak 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 dhak, and same thing only shh 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 shh. So if the pulse is coinciding with the murmur, that will be a systolic murmur. That we say it's a systolic murmur. That's how we do it. I'll take one class on murmurs or on a proper CVS examination someday if you want, and we'll do further. So Zainab Akhtar has very beautiful answering tachycardia, bounding pulses, hyperdynamic precordium, palpable dorsalis pedis artery, and which is a continuation of anterior tibial artery. Very beautifully said. These are the very important clinical features of the patent ductus arteriosus. Please put a like button if you're able to understand. Please put a like button. Hmm. Okay, buddy. Okay. Next, and very importantly, and then what are the other features of? Now we are gonna end this topic. What are the other features of what you call patent ductus arteriosus? Remember, wide pulse pressure of more than 25 millimeter of mercury, and a hyperdynamic precordium. That hyperdynamic circulation or hyperdynamic precordium, matlab visible when the heart rate is so much, tachycardia is so much, pulses are so bounding, anterior tibial artery is so much easily palpable. What will happen? There will be a hyperactive precordium. Hyperactive precordium, matlab visible pulsations of more than 2 rib spaces. बहुत दिखती हैं pulsations, visible pulsations of more than 2 rib spaces. Done. That's it. And an ejection systolic murmur in some cases. And of course, persistent tachycardia. Persistent tachycardia. वो तो बता ही दिया मैंने, heart rate बढ़ेगा. These all are the important features of patent ductus arteriosus. Okay. Next question. Let's finish this topic fast. Which day of life we should expect such symptoms? ये सारे symptoms, these all symptoms in a case of patent ductus arteriosus, which day of life you will get them? The answer is roughly at day 3 to 4 days of life. So at day of life 3 or 4, you will get the symptoms of the PDA. All these hyperdynamic precordium, easily palpable dorsalis pedis artery and everything takes time. It takes time for the symptoms to manifest. So roughly day 3 to day 4. Number one. Number two, very importantly, yeah, this is a good question. Who will tell me? What is the gold standard? What is the gold standard investigation of choice in diagnosis patent ductus arteriosus? Anyone? So now, Hanji. Okay, dear, I'll take a class on CVS examination. Just be in touch with me on the Unacademy app and on the YouTube Unacademy channel. We will cover the whole pediatrics. And yeah, done. So, what is the gold standard investigation choice? The answer is echo. Echo कराना है. ठीक है, जो ओसामा कह रहा है, दीपक कह रहा है that what you called in a busy OPD how to diagnose this PDA. At least once you see a murmur, once you hear a murmur, at least tell them to get a echo done. Tell them to get a echo done. And most importantly, as there is increased heart rate or tachycardia, as there is bounding peripheral pulses, as there is hyperdynamic precordium, always restrict the fluid. Don't learn that how much ml per kg per day. Just remember the fluid should be restricted. At least this much you should come to your mind, that fluid should be restricted. कितना restrict करना है वो इतना important नहीं है. How much is not important. Just restrict the fluid. ओके, स्टेफाइलोकोकस दैट विल डू इको के डियर, इको कराएंगे, ठीक है, नॉट यूएसजी, नो प्रॉब्लम. Okay, Pancake says coronary steal phenomenon is due to dilatation of the coronary artery in pre-existing coronary artery disease, and as more blood will go towards the dilated vessel. So very beautiful, Pancake. So Pancake has told, see, remember guys, there is something known as ductal steal phenomenon. There is something known as ductal steal phenomenon, and there is something known as coronary steal phenomenon. Very importantly, very important exam question. Ductal steal phenomenon and coronary steal phenomenon. Ductal steal phenomenon, I told you, you see in patent ductus arteriosus, where the ductus arteriosus is stealing the blood from the aorta. That is ductal steal phenomenon. Coronary, what you called? Yes, very good. So yes, what you called? Yeah, Lokesh has given me a orange hat on an academy. Love and care in your words. Thank you, Lokesh. And we have a coronary steal phenomenon. Coronary steal phenomenon is due to dilatation. Please, guys, remember it is due to the dilatation of the coronary artery. Coronary steal phenomenon is due to dilatation of the coronary artery. Why there is a dilatation of the coronary artery? Like it is due the coronary steal phenomenon is due to dilatation of the coronary artery in the pre-existing coronary artery disease, as more blood will go towards the dilated vessels. Okay, in a pre-existing coronary artery disease, there is a dilatation of the coronary artery, and that is known as coronary steal phenomenon. In a case of coronary artery disease, there will be dilatation of the coronary artery. That's known as coronary steal phenomenon. Thank you, Pancake. Thank you. Seen in MI, myocardial ischemia. This is seen in MI. Thank you, Pancake. Please, guys, everyone, please can we say thank you to Pancake? Thank you. Pancake has told us a very nice thing. In a coronary artery disease, those disease vessels will, there will be dilatation of those coronary arteries, and that is known as to allow the more and more blood to pass through them, and that is known as coronary steal phenomenon, seen in myocardial infarction. So ductal steal phenomenon is seen in patent ductus arteriosus, whereas coronary steal phenomenon is seen in myocardial ischemia. Okay, so please guys say thank you to Pancake. She has told a very wonderful part. So the clinical features of patent ductus arteriosus, we have covered wide pulse pressure, bounding pulses, hyperdynamic precordium. See, once you understand the concept and study, right, you do not forget it. Okay, heart rate will increase, so all bounding pulses, hyperdynamic precordium, plethoric lung fields. What is plethoric lung fields for a newcomers? Increase pulmonary blood flow. Increase pulmonary blood flow. If you're a newcomer, you know that, right? If this is what you call, yeah, this one, if this one is the ductus arteriosus, when more and more blood enters from the left side of the heart to the right side of the heart, and then it will go to what, yes, then it will go to the lungs. When more and more blood goes toward the lungs, that is known as increased pulmonary blood flow, mean that is known as plethoric lung fields. Okay, and the patient will have, Oscar चलते हैं अभी 5 मिनट, my doggy is calling, he wants to go out. So the patient will have more URTI and LRTI infections. So that's what the whole story is, right? um, hmm. Okay, that's very sweet. So that's what, and the blood flow to the kidney will be compromised, GIT will be compromised, patient will have necrotizing enterocolitis, acute renal failure, hepatomegaly, everything. What are the ECG findings? Let's finish the topic. What are the ECG findings of patent ductus arteriosus? क्या मिलेगा? Will you see a right axis deviation, or will you see a left axis deviation? So of course, even my doggy Oscar also can tell this answer. So yes, you will see a left atrial hypertrophy, left ventricle hypertrophy, or nothing but left axis deviation. Yes, Pancake. So Pancake, where are you from? You're from Delhi? If you're from Delhi, of course I will bring my doggy to you. Yes, Osama is right. Yes, bro. Yes, Sayani. Very good. Priya. Anji. So the ECG findings are left atrial hypertrophy, left ventricular hypertrophy, left axis deviation. Yes, these three points will you'll get. And also, what happened in chest X-ray? What will you see in chest X-ray? Same thing only, Hanji. So yes, in chest X-ray also you will see cardiomegaly with plethoric lung fields. Okay, and for diagnosing cardiomegaly, you need to do the CT ratio. What is CT ratio? Have you heard of CT ratio? Cardiothoracic ratio. Cardiothoracic ratio. CT ratio is done to diagnose, to rule out cardiomegaly. Hanji. Okay. You're not from Delhi. Where are you from? Then, if you're not from Delhi, medical management. Very easy medical management. So three options we have. Everyone knows about it. Either you can give me indomethacin, either you can give me ibuprofen, or you can give me what you call paracetamol. Thank you, Shubhangi. Thank you. So sweet of you. Thank you. Indomethacin, ibuprofen, or paracetamol. Okay. Now options are what are the dosages? Paracetamol is given 15 mg per kg per dose, 6 hourly for 3 days. Again, for you guys, don't remember the dose. I don't want you to stress extra on your brains. Just you should know the drug names: indomethacin, ibuprofen, and PCM. See, remember, there's something known as hard work and something known as smart work. जितना brains को allow चाहिए, whatever required for the brains, that much you remember. Rest don't remember. Number one, yes, exactly. Pancake says, I am from Moon. If you are from Moon, then I am from Pluto. Okay. So, what do you call the options for closing that patent ductus arteriosus are indomethacin, ibuprofen, and PCM. Acha, before what do you called before ending the session, no, एक मुझे याद दिलाना मैंने I have some very nice thing in my mind, like a motivating stuff. Remind me, that's it. Okay. So we have a for closing the PDA, we have paracetamol, ibuprofen, and indomethacin. Paracetamol, the dose is 15 mg per kg per dose, 6 hourly for 3 days. Ibuprofen has a better safety profile. It has a better safety profile, and there are less chances of side effects like NEC or acute kidney injury of ibuprofen. So ibuprofen is kind of a better. This is the syrup. That's what it comes in our hospital. Syrup ibugesic or ibuprofen. The dose is 10 mg per kg. Again, for you, it's not important if any, if because many of our super specialty students are watching this session. So for super specialty students, 10 mg per kg we give ibuprofen, followed by 5 mg and then 5 mg. Okay, that means you know 10, 5, 5. Okay, ibuprofen ka dose. A PCM was 15 mg per kg per dose, 6 hourly, and ibuprofen is 10 mg per kg per dose today, then 5 mg tomorrow, then next day again 5 mg. Okay, so options are indomethacin, ibuprofen, and PCM. The PG entrance question number one: what are the contraindications of giving indomethacin? हाँ जी, बताओ. ठीक है, हाँ जी. Okay, so yeah, what are the contraindication? In which case you will not give me indomethacin? The answer are: number one, if I'm having thrombocytopenia, if my platelet count is less than 60,000, please don't give me indomethacin. If I'm having any bleeding, any blood aspirates, any bleeding, clinical bleeding I'm having, don't give me indomethacin. If I'm having acute kidney injury, if my creat is more than 1.6, don't give me indomethacin. Very good. Rachna is right. Pancake. Okay. Staphylococcus, Osama. Very good. Okay. So what are the contraindication of giving indomethacin? If my platelet is low, if I'm bleeding, or if my creat is very high. Okay. These three are the important contraindications. And if my urine output, everything is related to kidney. If my urine output is less than 1 ml per kg per hour. Yes, very good. Yeah, increase bleeding count. इंक्रीज ब्लीडिंग काउंट तो नहीं दिया, लेकिन थ्रोम्बोसाइटोपिनिया में तो होगा. इंक्रीज डिक्रीज प्लेटलेट काउंट में होगा. दैट्स इट. ओके. एंड इफ आई एम ब्लीडिंग, अगेन ब्लीडिंग फ्रॉम एनीवेयर, इफ आई एम हैविंग इंट्रावेंट्रिकुलर हेमरेज, और इफ आई एम अ डायग्नोस्ड केस ऑफ नेक्रोटाइजिंग एंटेरोकोलाइटिस, दैट टाइम डोंट गिव मी इंडोमिथासिन. ओके. नेक्स्ट. Okay, this is a good question. This was a FMG question. If the option comes, if MCQ comes, indomethacin also, ibuprofen also, both are given to close the PDA. If both options are given, indomethacin also, ibuprofen also, what will you choose? What will you choose? Hmm. Okay, very good. So the question is, what will you choose? क्या choose करेंगे आप? आप ibuprofen choose करेंगे? आप indomethacin choose करेंगे? क्या choose करेंगे? हाँ जी. Okay, many people says many answer. Priya is saying something else and Rashi is saying something else. Okay, so the best answer to this question will be you will choose ibuprofen. Ibuprofen is preferred over this. So ibuprofen is preferred. Why? Because see, between the, okay, number one, remember, thing I'm removing, I'm just having a tablet, I'm having headache actually. So between indomethacin and ibuprofen, number one, ibuprofen is preferred. Number one. Number two, between oral ibuprofen and oral PCM. Yeah, that's a very good question. Between oral ibuprofen and oral paracetamol, what will you choose? Then the book says oral PCM is preferred. Oral PCM is preferred because it lacks major side effects of NSAIDs. Ibuprofen is NSAIDs only, non-steroidal and non-steroidal anti-inflammatory drugs. It's like a small Disprin, the one which I took. So I'll repeat again, between oral ibuprofen and oral paracetamol is preferred. But at the same time, but is the PCM drug of choice for closing the patent ductus arteriosus? Is the PCM the drug of choice? The answer is no. Paracetamol is not a drug of choice. It is it because why? Because paracetamol showed adverse effects on neonatal mice. There was experiments of neonatal mice, and later there was a development of autism in children also after prenatal exposure to the paracetamol. So there was the problems in the neonatal mice, and later there was autism issues also with paracetamol. That's why paracetamol is not the drug of choice. So then again, next option, oral route is preferred or IV route is preferred. If I am given two options, oral route like oral ibuprofen or IV indomethacin, the answer is oral. Always prefer the oral route. Okay. Can we continue enteral feed while giving drug? That's another question. If a patient has been diagnosed with patent ductus arteriosus and baby is on Katori spoon feed or any kind of feed, what is KSF? Katori spoon, paladai, that Katori spoon feed. Okay, paladai feed. What is paladai? If you don't know, if you're a newcomer, again watch my previous videos. I have explained in detail with images of paladai. Okay, so if my child of PD is on Katori spoon feed, can we continue enteral feeds while giving the drug? The answer is very yes, you can, not a problem, you can continue, कोई ऐसी बड़ी बात नहीं है. Okay, and last, this was a medical management, and the medical management, I understand ibuprofen is our best choice, ibuprofen oral, otherwise indomethacin. Next, surgery अगर करानी हो, if I have to surgically close the patent ductus arteriosus, there's a coil, nothing but coil embolization. I do the coil embolization is what I do, and I prefer to close the PDA before 1 year of age. Almost all the, even ASD also, remember ASD should be closed surgically on the first birthday. ASD should be closed on the first birthday. BSD should be closed from 6 months to 12 months in between. ASD should be closed on the first birthday. BSD should be closed between 6 to 12 months. And again, patent ductus arteriosus is preferable to close before 1 year of age. Okay, that you should know. है ना dear? This is the coil, a small surgical ligation, nothing but coil embolization is what we do. Okay, that you should know. And what are the complications of surgical closure? Now, again, this is a super specialty question. Okay, because super specialty students, once we take a class, we always explain this. What are the complications of surgical closure? So the complication of surgical closure will be, number one, the patient can have pneumothorax. Number two, the patient can have chylothorax. Number three, infection. Number four, vocal cord palsy. These are the four important complications a patient of surgery, post-surgery for PDA. The patient can have pneumothorax, chylothorax infection, and vocal cord palsy. Vocal cord palsy. Pneumothorax, chylothorax infection, and vocal cord palsy. Okay, that you should know. Next, very important, yeah, this is everyone knows. हाँ जी, displacement of coil. हाँ, तुम अगर ऑपरेट करोगे तो डिस्प्लेसमेंट ही होगी कॉइल की. डिस्प्लेसमेंट नहीं होती कॉइल की, कॉइल छोटी सी होती है, वहीं रहती है वो, ठीक है. Okay, and if I want to, two questions are always there. I want to keep the PDA open, what will you give me? I want to close the PDA, what will you give me? So closing the PDA, you of course you can that we have already covered. Ibuprofen, indomethacin, paracetamol. Three options we have. Ibuprofen is our best oral choice. Indomethacin is our best IV choice. But in our hospital we give ibuprofen, and in my Lady Harding we used to give paracetamol also. So paracetamol and ibuprofen has been given in government hospitals. So that you should know. And yeah, I want to keep the PDA open. What will you give me? Very, very, very important. कैसे करता है Zainab vocal cord palsy? I have no idea, dear. Nelson just says that it can cause vocal cord palsy. Like it has dermatomes or some nerve connection of that PDA over that side. So that's why vocal cord palsy. But they have not mentioned much in the Nelson or in any other Avery or Pediatric Cardiology Park book. Okay, so if I want to keep the PDA open, then number one, very important, open, right? So you will give me PGE1. You will give me PGE1 analog, and that is L-prostadil. Please remember, Shubhangi, PGE2. PGE2 you can't give, Shubhangi. Why is, Shubhangi, you can't give PGE2? Because PGE2 is endogenous. PGE2 is endogenous. Endogenous matlab placenta. Placenta secretes PGE2. Placenta secretes PGE2, which helps in keeping the ductus arteriosus open. Placenta secretes PGE2, which helps to keep the ductus arteriosus open. Once the baby is out, placenta is cut. Once the placenta is cut, PGE2 levels goes down. Once the PGE2 levels goes down, ductus arteriosus starts to close. Ductus arteriosus starts to close, right? And that's how it is, right? And that there are three things, responsible for the closure of the ductus arteriosus. Number one, placenta is cut. Number two, oxygen. Oxygen is a very good smooth muscle constrictor. Oxygen is a good smooth muscle constrictor. Once the baby take a breath, once the lungs are nicely functioning, then oxygen plays a very important role, which is a smooth muscle constrictor. And then next component is bradykinin. Bradykinin that also helps in closure of the ductus arteriosus. कहाँ से हम कहाँ चले गए? The best answer is PG even analog L-prostadil. It is given in infusion. I have given it only once in my lifetime. Normally तो हम ibuprofen से मस्त बढ़िया काम चलाते हैं. So, oral is always preferred. Oral is always preferred. Remember that. PG even analog you can give me, that is L-prostadil, and infusion you can give me number one. That's it. And what else? What else? PDA. So patent ductus arteriosus, right? Patent ductus arteriosus. What is the triad of congenital rubella syndrome? Like we are reading. This is the okay. If okay, this is the homework. This is the homework. The homework is what is the triad of congenital rubella syndrome? Okay, and why did I give you this homework is connected to PDA. This homework is connected to patent ductus arteriosus. So this is the homework for for the next class. Tomorrow we have a class, no? But tomorrow we have a morning class because tomorrow we have a what do you call, not we but I have a night duty tomorrow. Tomorrow is my night duty here. That's why. So we have a class. What time do we have a class tomorrow? Anyone? Does anyone know? Because I also don't know. So the class is tomorrow morning only. I think it's at 9:30 or 10:30. Let me check. If you guys are free, please come tomorrow. और मैं बताता हूँ मैं आपको एक कल क्या तारीख है. Tomorrow is we have is 15th, right? 15th, yes. 9:30 a.m. I have a class. I have a class 9:30 a.m. I have a class tomorrow. Again on the YouTube only. I have a class tomorrow 9:30 a.m. where we gonna keep the what you called continue the important topics of cardiology. Very good question. Zainab has asked a very good question. Zainab, a very wonderful question. Why do we keep PDA open? तो PDA ओपन करने के कम से कम 10 कारण हैं. There are 10 reasons to keep the PDA open. I have discussed this in the previous classes. Zainab, I think you're a new student. That's why you have not attended the previous sessions, dear. I have taken a Bakaida 30 minutes class on duct dependent congenital heart disease. Patent ductus arteriosus, patent ductus, this one, patent ductus arteriosus, or I can say duct dependent congenital heart disease. It's a separate 45 minutes topic we have done, but I'll just tell you what you called in a very short and smart way. Duct dependent. Why do you want to keep the ductus arteriosus open? Number one, right side. If I talk about right side issues, this is the pulmonary artery. This is a pulmonary artery. If I close this pulmonary artery leading to pulmonary stenosis, right? If I make a pulmonary stenosis, the blood from the superior vena cava, inferior vena cava, which enters the right atrium, and then the deoxygenated blood which enters the right ventricle, then normally it should enter the pulmonary artery and normally it should go to the lungs for the purification. But now in a case of pulmonary stenosis, the blood cannot go to the lungs. So now in this case, I would like to keep the PDA open so that for the bifurcation of the blood, yes or no, for the bifurcation of blood, I would like to keep the PDA open. So now pulmonary stenosis becomes one duct dependent congenital heart. Okay, number one. Left, very importantly, in on if I talk about left side, let me change the pen color fast. Yeah, if I talk about the left side, what do you have? What is this? This is the aorta, right? So now imagine again, if I have a aortic stenosis, same reason. If only, well, I mean isolated aortic stenosis, only aortic stenosis, then the purified blood which goes to the left side of the heart and it goes down, now it cannot go down because of the aortic stenosis. Now again I want a ductus arteriosus for the bifurcation of the blood. So aortic stenosis, coarctation of aorta, interrupted aortic arch, all these conditions I want to keep the ductus arteriosus open, so I'll intentionally keep it open. On the right side we have pulmonary atresia, what you call pulmonary stenosis. These are even in some cases of tricuspid atresia also. And a very important condition, TGA. What is TGA? Transposition of great arteries. In a case of TGA, transposition of great arteries, again we will keep the ductus arteriosus open. Why you will keep it open? Again, in my previous classes I have told this, Zainab, you must watch them because it's again a half an hour topic, why you keep ductus arteriosus open in a case of TGA. But TGA anyhow will come in future further topics also. I will explain it again someday. So this much I can tell you. Okay. हाँ जी, और क्या था? हाँ जी, वाइड व्यू हो गया। ओके, यस पैनकेक, डीक्यू और आईक्यू। यस, डीक्यू और आईक्यू का ना, मैंने पैनकेक एक काम करता हूँ, कल सुबह मैं बताता हूँ डीक्यू और आईक्यू क्या। बिकॉज डीक्यू हैज दी डेवलपमेंटल क्वेश्चन एंड इंटेलिजेंट क्वेश्चन, इट हैज सम फॉर्मूलाज, देन व्हाट इज अ मोरन, व्हाट इज अ इडियट, एक दो स्लाइड्स बना के ना मस्त सा मैं एकदम वो करके फिर मैं उसको होमवर्क को डिस्कस करूंगा, ठीक है? एंड व्हाट यू कॉल्ड, so there are three homework questions are left, which we'll talk about tomorrow morning 9:30 a.m. होमवर्क के तीन क्वेश्चंस थे. क्वेश्चन नंबर वन, इन फ्यू डेज बैक आई आस्क यू व्हाट इज डिफरेंशियल साइनोसिस एंड व्हाट इज रिवर्स डिफरेंशियल साइनोसिस. This question number one, this homework I will tell you the answer tomorrow morning 9:30 a.m. What is differential cyanosis and what is reverse differential cyanosis? Second homework is nothing but developmental quotient and intelligent quotient, what you called formula. Yes, anyhow, हाँ exactly. So Pancake ने पहले ही बता दिया, developmental age upon actual age into 100, developmental age upon actual age into 100. Yes. Developmental age upon actual age into 100 is DQ, and IQ also I'll tell you tomorrow morning. Pancake, I have night duty tomorrow, dear. I have a night duty tomorrow. Tomorrow 12 noon my duty will start, and next day morning around 10 a.m. I will come back to my house. So I have a very stretchful duty tomorrow. That's why I only have a morning slot free. That's why I'm taking a class tomorrow 9:30. I'll be taking a class. हाँ, कल मेरा एक ही क्लास है सैटरडे को 9:30 a.m. ठीक है? And yeah, okay, and yeah, so that's what. So guys, this is the three homeworks I have given you. Tomorrow 9:30 class I will I will tell you the answers. Differential cyanosis, reverse differential cyanosis, a formula of DQ IQ with example, and also one question of this only, that what is the, what do you call, कहाँ गया वो, what is the triad of congenital rubella syndrome? These three questions I will. ठीक है, और कुछ बातें करनी हो इन द क्लास, समझ में आया सबको? हैज एवरीवन अंडरस्टूड, यस और नो? प्लीज पुट अ लाइक बटन इफ यू अंडरस्टूड. अच्छा, हाँ, याद आ गया मुझे. पैनकेक को सब कुछ याद है. पैनकेक इज लाइक लाइक मल्टी टैलेंटेड गर्ल, एंड शी इज अ गर्ल, मल्टी टैलेंटेड गर्ल. ओके. तो क्या कहते हैं उसमें, तो क्या कहते हैं, हाँ. So I think in the previous class also, in some classes back, I told one quote. Okay, it was from one movie, that Vidya Balan movie. I wanted to share it once again with you. Now listen to me very carefully. It's just a very simple quote. It's just a 2-3 lines wala quote, which I think you already know, but I will again tell you that quote because I think it's good to explain about it. बस 2 मिनट, दरवाज़ा बुला दो प्लीज़. So then I'll just tell you the quote. हाँ, तो it was like तो दोस्तों, शहर की इस दौड़ में दौड़ के करना क्या है? शहर की इस दौड़ में दौड़ के करना क्या है? अगर यही जीना है दोस्तों, तो फिर मरना क्या है? तो दोस्तों, शहर की इस दौड़ में दौड़ के करना क्या है? अगर यही जीना है दोस्तों, तो फिर मरना क्या है? पहली बारिश में ट्रेन लेट होने की फिक्र है। भूल गए भीगते हुए टहलना क्या है? सीरियल के किरदारों का सारा हाल है मालूम, पर माँ का हाल पूछने की फुर्सत कहाँ है? अब रेत पे नंगे पांव टहलते क्यों नहीं? 108 है चैनल, पर दिल बहलते क्यों नहीं? इंटरनेट से दुनिया से तो टच में हैं, पर पड़ोस में कौन रहता है, जानते तक नहीं। मोबाइल, लैंडलाइन सबकी भरमार है, लेकिन जिगरी दोस्त तक पहुंचे ऐसे तार कहाँ हैं? कब डूबते हुए सूरज को देखा था, याद है? कब जाना था कि शाम का गुजरना क्या है? तो दोस्तों, शहर की इस दौड़ में दौड़ के करना क्या है? अगर यही जीना है दोस्तों, तो फिर मरना क्या है? This was a quote. This was a very nice motivating quote. I just thought of sharing it again. हम पहले एक बार कर चुके हैं, आई थिंक ओसामा को, और ऑलरेडी पता होगा हम, दिस कोट आई लाइक्ड इट, तो आई जस्ट थॉट ऑफ शेयरिंग इट. I hope you liked it. This quote has very wonderful meanings and very strong, what you called this. Yeah, and yeah, ma'am was there, and I told her to close the door. So that's the whole thing. Okay, thank you so much everyone for this wonderful session. Take care and have a wonderful evening ahead. See you tomorrow morning 9:30 a.m. same on this what you called YouTube channel, and tomorrow morning 9:30 we'll continue and finish cardiology. Bye bye. Stay safe and be happy.